exam. My name's Susie. No, hang on. Alan. Yeah, my name's Alan. And I'm your chief exam steward for today. Joining me in the exam hall this afternoon is our beautiful trolley dolly, I'm sure you'll all agree, the wonderful James Jimmy Boy Ayton. And our regular cabin floozy, it's everyone's favourite, Boozy Susie. Ladies and gentlemen, we would like to apologise for the changes to this year's assessment timetable. Unfortunately, we've had to cancel our anatomy practical exam since a significant number of you can't seem to tell your ass from your elbow. In addition, the difficulty of this year's OSCE has been modified to make sure it pays particular strengths to your particular skills. So we're going to be replacing breaking bad news with a station on relaying moderately unfortunate information about a verruca. And basic life support with AED will now be applying a sticky plaster to a scratched finger. The remaining 6 stations will be rest stations. Ladies and gentlemen, the exam hall is now ready for boarding. Before entering the exam hall, can you please be sure to have your matriculation cards ready for inspection. Please note that due to exam regulations, we can no longer accept cash bribes. Donations by Visa and MasterCard remain welcome as ever. Seating in the exam hall is unreserved, but you may find you enjoy your assessment more if you sit close to the class SWAT. Please note that seating is strictly 1 student per seat, even if you are married. Once seated, you will not be allowed to leave the exam hall during the first 30 minutes of the assessment. Once again, we'd like to welcome you aboard this exam, especially those of our students seated in the first and second class honours section of the exam. Could you all please now show respect to the invigilators by paying attention to our pre-exam safety presentation. We appreciate that some of you may have sat the same exam several times before, but some of the procedures used in this examination may have changed to reflect recent security concerns. Please feel free to place your valuables around your desk, on the floor, littering the corridor, even though there's been this clear instruction to leave them at the back of the exam hall. You are permitted to bring drinks on board this exam, but any drinks you bring in must not contain colourings, flavourings, nutrients, artificial sweeteners, natural sweeteners, carbonated gases, or in fact any other item apart from H2O. Drinks must be stored in cleared, unlabelled bottles, and our invigilators will spend at least 5 minutes checking you've not engraved the entire contents of a textbook onto the plastic. You are required by university law to complete the front of your exam paper with your name, module, and candidate number. For those who matriculated this academic year, your candidate number is the first 5 digits whispered to you by a member of staff whilst you were running down the corridor late for anatomy. For those who matriculated pre-2013, you'll find your candidate number tattooed on your left buttock. We are expecting a relatively straightforward assessment today, but conditions can change rapidly in the exam hall. Those of you sitting MD 3001 may experience a question on turbulence, and sick bags are located on the table in front of you for those sitting MD 3002. Whilst we try our best to ensure the safety of our exams, difficult questions do sometimes occur. In the unlikely event of a pharmacology question, please adopt the brace position and cry. In the event of excess crying, you'll find water wings underneath your seat. Should we experience experience unexpected depressurization of the exam hall, a Douglas bag containing 80% CO2 and 20% oxygen will deploy. As will Dr. Fleet, who will award a 10-point bonus to the first student to hold their breath for longer than 5 minutes. I think we have a winner. In the event that you need to perform an emergency evacuation, you'll find the toilets at the back of the exam hall. In the event of a fire during an anatomy question, Susie, please report to the front of the stage. Stage directions are optional. At the stage of the evening. In the event of a fire during any anatomy question, you'll find pronation, supination, abduction, adduction, circumduction, and circumcision movements. Of little use. The exits, however, are located near the inguinal canal. Ladies and gentlemen, I think that's our final candidate boarding just now. So we're about ready to start the assessment. Please can you return all slouches to the upright position and turn off your hopes and dreams for the future. Invigilators will now perform our final pre-exam checks. Remember that there are several items explicitly banned by our university assessment regulations. Please note, no sporting equipment is allowed in the exam. Unless, is that the football that went between Joe Walsh's legs? This football is allowed as it's now being mascoted to the level of school mascot. The following items are completely banned and may not be used for the duration of the exam. No smartphones, no smart glasses, no smart watches, no smart underwear, no smart hair, and most importantly, for the duration of this exam, no smart arses. Ladies and gentlemen, failure to comply with these regulations will result in your exam being declared void, and you will be required to attend a 2-hour one-on-one undressing from Professor Guild. A comprehensive debriefing from Professor Guild. A severe dressing down from Professor Guild. Or the Dean, if we can find him. On behalf of the Dean and Vice Dean, thank you for choosing to study at the University of St Andrews Medical School. We hope you find your onward journey to one of our partner institutions a pleasurable experience. Our apologies again for those of you travelling onwards to Dundee. Good night.